Basically, we are not finding large hospitals. We are like a catalyst for every doctor in Pakistan.
Saad, in Pakistan, there's millions of people who are going to unverified doctors.
Tells you about the diabetes and heart disease before you diagnose a heart attack or sugar.
If you see OpenAI or Gemini, these models are trained on huge amount of data. How much is your accuracy right now of the output that it is giving, and how accurate does it get? So today we have Saad Jangda with us, a great friend, an inspiring entrepreneur, and the founder of Ilaaj AI. How does AI know that I'm sick?
So Ilaaj AI, basically what it does is it takes the patient information, it takes its X-rays and its medical records and histories, and it creates a proper data, and then we check against the X-rays through our AI models that are custom trained on 220,000 X-rays. Uh, so first of all, if you have pneumonia, let's say, and you uploaded your X-ray on our platform at Ilaaj AI, so Ilaaj AI will first of all check your X-ray against our trained data, custom AI model, and then it will tell you that you have these pathologies like pneumonia, cardiomegaly, and then we also have an option like if you have one of these pathologies, like for example pneumonia, so our platform will automatically use your location data, and it will tell you doctors around that are specified for these pathologies, and then will let you book an appointment from them. So what it does is we have our multiple X-ray analysis model. We also have an risk scoring model that tells you about the diabetes and heart disease before you diagnose a heart attack or sugar. So our risk scoring model is trained on a 10-year study from Bangladesh, and we have trained our own AI model. And you enter your custom details on your daily lifestyle, and you also enter your blood pressure details and your daily habits like smoking or anything similar to that. And that from that data we use that, and we tell the patient that you will be diagnosed in particular time, or you are being diagnosed. So we take customer data, patient data, and then we give it to the doctor, and then the doctor takes it as a pre-diagnosis, and it also helps conduct diagnosis in a much higher level than previous if they are not using any platform.
So Saad, you mentioned about 220,000 X-rays. The question here is the accuracy of the output that the model is providing. Do you think that the more data it is trained on, for example, if you see OpenAI or Gemini, these models are trained on huge amount of data. So do you think that if in the future, for example, large AI keeps training its model, and obviously it will be trained by the people that are using the app also. Do you think the accuracy, how much is your accuracy right now of the output that it is giving, and how accurate does it get?
So currently our X-ray analysis model does an accuracy of around 85 to 86%, and our risk scoring model does around 82%. It's not like actual 100%, but we have trained on like multiple, like 100 200,000. If we increase that number of data, so we can achieve, I think we can achieve more than 95% accuracy. And you're saying correct that OpenAI models like Opus or like Gemini and ChatGPT, they're trained on a large amount of data. The problem with those models, large language models, is that they are specified not for one case. Let's say we want to diagnose a patient with cancer, and we let's say have data of like around 1 million X-rays that cancer patients from aging from 10 to 50 or 60 age. So we can take that data and train our own custom model, and it will provide more accuracy than a large language model, because the large language model is trained on multiple and large amount of scale of data that is not specified on a particular pathology or any a disease or something like
I think it also reduces the risk of um human miscalculation, or whether if a doctor misses something. For example, Even I'm going through rheumatoid arthritis, and today I visited my third doctor, and there is something slightly new that every doctor has been discovering. So I think that human error point goes out of the question when it comes to actually the diagnosis that AI is providing, because it is working on based on X-rays or information that is already
Information.
available, the big data that it is actually using. Something that I have noticed recently in terms of conversing with AI for my medical advice was that when I got home today from the doctor, his writing was so bad that I could not understand. And just to see what medicines he had prescribed, I uploaded the images in Gemini, and I asked Gemini, help me understand what he's saying. And Gemini accurately gave me all the medicines names and what they were going to be used for, or what the doctor had in mind while giving me uh, those medicines. I think that is also an important aspect of your app, the OCR technology. For example, the OCR technology, explain that part of the app to me. How is reading the prescriptions uh, that comes into play while using Ilaaj AI?
Yeah, you're absolutely right. That's a really important part for in a patient's life. There's two perspective for this in our app. So the first like most important factor is that, for example, I'm a patient in Karachi, and you're saying that you went to a doctor and you take his prescription, uploaded it to Gemini. So our app does the same. It creates. We use like a multi-language OCR model that if let's say if the prescription is in Urdu, and sometimes large language models can't understand regional languages, so our app also translate those medicines into English or understandable languages for the patient. So what it does is it records it. First of all, it records the patient's medicine history, and also give guidance to the patient. For example, let's say if your doctor has given you 500 mg medicine that is not suitable for example, a sugar patient or a heart disease patient. So what our app does is it gives warning to the patients that this might happen if you take these medicines. So this is also an important factor. And another factor is that let's say if a doctors want, let's say a patient comes first time to the doctor, and they don't have any history medical record for this patient. So what a doctor can do does is it can take the prescription pictures, and it can create a large amount of records and the prescriptions and medicine that the patient has taken over time. And it also creates a profile in our Ilaaj AI that helps in further in pre-diagnosis and diagnosis in the future.
So Saad, I've used some apps. I think my recent interaction was with Ola Doc, and in when I was in Lahore and I had to book my appointment, there was also this app. I don't remember the name, but it had all the doctors. Like I could search the doctors for my specific medicine, and it would provide me all the doctors available, and then I could approach the doctors and take appointment from them. So is it also something part of Ilaaj AI when you say that they recommend you the doctors in the area? Is there a way to get in touch with the doctor's assistants or book their appointments, and how does that work?
Yeah, so actually booking and talking to the doctor is the main part of any diagnosis, and uh, only AI cannot help you, diagnose your any disease. So what we have integrated this feature in our platform, that what it does is if you have any disease or we diagnose any disease regarding your data, so we have like multiple list of doctors, and we provide your nearest doctor location. For example, if you have any disease like heart disease, so we will provide you heart disease doctors near your areas and that are also certified. And if you want to book an appointment with them, we can provide contact details, and we can also schedule appointment online or physical if you want. So what it does is it does not like give you like for example, if you upload your X-ray picture and it gives diagnose any disease like cardiomegaly, it will not only tell you that, it will also give you contact details of the doctors, so you can communicate with them and help in the disease.
Saad, in Pakistan, there's millions of people who are going to unverified doctors especially as you mentioned, this was something that would help in the rural areas. I know for a fact personally that there are a lot of uncertified doctors who even sometimes don't have MBBS, and people go to them and they prescribe medicine. So Ilaaj AI, is it like fighting the big hospitals and big names, or is it like providing you with the certified accurate doctors?
Basically, we are not finding large hospitals. We are like a catalyst for every doctor in Pakistan, wherever like it's sitting in Karachi or any interior area of Sindh, Punjab, KPK, Balochistan, anywhere in Pakistan. So our like main purpose is to provide a faster way to diagnose the patient before the disease reaches the patient. I'm going to give you an example of that. Let's say before ChatGPT, the content writers used to write content with their own hand, and we used to use their own creativity. But when ChatGPT came, it was creating content like much faster speed than any human ever did. So the content creators didn't die, the content writers didn't die, they're writing still content, but what they're doing is they're using AI to help write more and more content at more faster speed. For example, if they used to write 10 scripts per day with their own creativity, now they're writing like around 50 to 60 scripts with using AI and using their own creativity, using new ideas that AI is providing. So Ilaaj AI is also doing same with the doctors. We are providing an AI agent, and it's we are basically increasing the doctor productivity and patient time more, so the doctor can see more patient in a single day and diagnose more and more patients. Sometimes we also have like a regional language feature, a voice feature. If a person is sitting in, for example, Thatta, and a doctor is diagnosing his any disease, and if he cannot understand any like Urdu language, so our app also gives a voice AI feature that the patient can talk in their regional languages. For example, if a patient is Sindhi, so our AI voice agent can talk to him in Sindhi, and it can also explain the prescriptions and medicines and diagnosis in his own regional language. So that also helps the doctors to not bring any person that knows Sindhi and then talk to him. That creates a lot of time hassle for the doctors, and especially in the clinics and small dispensaries. So Ilaji's purpose is to accelerate doctors' work and remove administrative tasks, and so the doctors can increase their patient uh, per day output.
So the $1 million questions are: if I'm a patient, what I'm paying for this service, and if you are a doctor, what are you paying for this? So like let us help us understand your revenue model, or let's say your cost model. What does it cost a patient, and what does it cost a doctor?
So basically, it doesn't cost to a patient. We are like directly charging the small clinics and small dispensaries around Pakistan. Currently, we have not contacted any big hospitals. First, we want to start with small clinics, uh, and we want to target first of all rural areas. 60% of population resides in rural areas of Pakistan, and there's also a doctor shortage. For example, in Karachi, Lahore, Islamabad, these big tier one cities, they have one doctor around 1,000 patients. But in rural areas, we have like around 3,500, one doctor against 3,500 patients. So that's a short supply of doctors. So we are going to target more in rural areas, and our revenue model or cost model would be like that. We are going to charge around 4 to 5,000 per month for a clinic. So let's say there are 4 to 4,500 estimated 4,500 clinics in Pakistan in the rural areas. So first we are going to start with the small 4 to 500. We are going to charge them monthly fee of 4 to 5,000, providing them our AI diagnosis model and our a platform and the doctors, and they can also earn first of all from the doctor, review doctor. Let's say a patient want a get a diagnosis, and his diagnosis what pneumonia. So our platform will detect pneumonia and will also recommend doctors around these areas. And if the doctor gets recommended for the patient, and the patient come to the doctor, so we get a commission for that appointment. So this is also another earning model for us. And for large hospitals, we are providing a solution that our AI models are highly trained or on very good data using a Chexpert data set that is worldly recognized data set around the world for X-ray analysis. So our model for big hospitals is like to provide large AI models. They can use um AI analysis for their X-rays rather than a doctor checking again and again and again.
So Saad, let's be real. The regulatory bodies in Pakistan aren't very tech savvy. So do you think that the government departments or bureaucrats or uh, how do you get approvals for something of this kind? Because to some extent, yeah, there is a risk of if you provide misinformation to a patient and their life is in danger. So this is something that you would need some regulatory permissions for. Till now, have you contacted anyone in the government, or is there some permissions that you have had to take, or are you like going forward? Do you have in mind that these set of permissions we would have to take for doing this project on a mass scale?
Currently, you are right. Any government will not allow any AI model just to check if the patient can live or any disease they have. So obviously, we are going to take approval from Pakistani government, and we are also going to take approval from medical regulatory authorities to check. And currently, we are in beta phase. We are not like contacted any government officials, but we have around 2 to 3 doctors there that are currently testing our a platform in their clinics and with their patients, and that are also providing them with good results. And we also have a review of the doctor, and he gave a really good review, like it's helping him in him in his clinic, and it's also diagnosing patient much faster than previous, like using medical records, physical records. So the medical approval is obviously really necessary in any country you are launching, whether it's US, Singapore, Pakistan, India. And before any approval, we are going to test fully our product. And once the test phase is complete, then we are going to launch publicly with the governments or regulatory approvals.
Do you have plans to expand it outside of Pakistan? For example, we have our neighbors such as India, where there's uh, a lot of people living under the line of poverty, a lot of people living in rural areas. In other parts of the world also, this problem is being faced. So, are there any plans that large AI will expand out of Pakistan, or this is just something that you are doing for this particular, for just Pakistani people?
So first, we have expansion plans. We are if we like complete our expansion in Pakistan, we are planning to expand to Indonesia, Nigeria, and Indonesia, Nigeria, and Singapore, because these countries have similar situations like Pakistan. They have like more population in rural areas, and rural areas sometimes they do not have qualified doctors, as you said previously. And we also provide like regional language support with our AI, with our AI voice agents, and AI chat model that can talk directly to patients with like voice in the call or like in a chat. So these countries have similar situation in Pakistan than Pakistan. If we have like fully expanded to Pakistan, then we are going to expand to these.
So, Saad, another problem that I, as a patient, have faced is the medicines not being available. So, for example, that I'm diagnosed with a certain issue, and AI has does it prescribe medicines? First of all,
Prescribing like
autonomously, if I'm sitting at home and I talk to the Ilaaj AI model, will it prescribe me any medicine? For example, this medicine you can start taking, or will
no,
it say
no.
like first get a prescription from the doctor?
No, it will give suggestions, but it will not prescribe currently, because we are not at this stage where AI is prescribing, medicines, because a patient does not. Many patients are not like suitable for sometimes like different medicines. They have like different formulas and for different patients. So it's not prescribing, but it's suggesting medicines that you can ask from your doctor, and you can take directly.
So if I am conversing and if it is actually artificially intelligent,
Hmm.
and my question is, why did you give me this certain diagnosis? Can it answer that question, or it's just a black box that we have to trust blindly?
So the AI models does not answer like the question like 2 plus 2 equals to 4. They use like neural networks, and they answer intelligently using their like, for example, they train on multiple amounts of data, and they are processed through multiple algorithms to answer a specific amount that you are going to ask. Like if you are saying it's a black box, so definitely it's not going to say like that. But you obviously you can answer the question like how did you reach to this diagnosis, and how what amount of data it was trained on, so it will
Hmm.
obviously going to answer.
So these were the questions from my end. But is there anything that you wanted to talk about and I missed that? I would give you a chance to like, if there's some part of your app or the idea actually, so like you can tell it to the audience.
uh, you basically asked like almost all the questions, and I also answered that. But one thing we are planning to add in this platform is, 2026 is the year of agents, and multiple startups are working on multiple agents that are, like for example, you have seen Cloud Cowork, and it's like works on your computer without any human level touching, and you can create tasks or agents that can do multiple amounts of work, like creating documentation, scheduling, calendar, emailing to people. So one thing we are planning to add in this platform is an AI agent that is specifically for doctors, and it will basically work like an open claw. You have It will take the control of your computer, and or we can provide a cloud, a virtual machine for you, for any doctor. What it will does, many doctors spend their time in scheduling, appointments, and seeing patient records, managing their finances, and also talking with their clinical admin staff. So that AI agent will solve 90% of the doctor works. For example, first of all, it's the main thing is appointment with the patients. Then managing their staff. The AI agent can also do that. For example, if their medicines are not available in their clinic, so the AI agent will tell the medical staff to bring those medicines, and communication with staff. And this agent will not only like replace the doctor, but it will really help. For example, the cursor help in many developers in coding. So that AI agent will work specifically for the doctor, and it also help in their daily task.
Saad, thank you so much for this amazing conversation with us. And hopefully, we'll talk more about other things in future, other startups that you have done. But this was something that really caught my eye, and this was something that I felt was very interesting, and the world should know about it. So uh, it's on record.
Thank you so much, Zaid, for hosting me on your podcast, and I'm really glad that you are doing this type of work, interviewing more and more founders. And I want to like motivate more people like these to create more and more podcasts for multiple startups, because videos like this brings Pakistani work on a global stage. This helps to increase their outreach for startups, and it can also increase their name on a global stage. For example, multiple startups that are working currently. So thank you so much for hosting, and see you next time.